The United States on Tuesday passed 400,000 deaths from COVID-19, a stunning total that is only climbing as the crisis deepens. The country is now averaging more than 3,000 coronavirus deaths every day, according to Johns Hopkins University data, more than the number of people killed in the September 11, 2001 terror attacks, and the daily death toll has been rising. The effects of a surge in gatherings and travel over the holiday are now coming into focus. The grim milestone of 400,000 deaths came on the last full day in office for President Trump, who has long rejected criticism of his handling of the pandemic. The situation threatens to get even more out of control, with new, more contagious variants of the virus becoming more prevalent. The Centers for Disease Control and Prevention warned last week that one of the new variants, first discovered in the United Kingdom, could become the predominant strain in the U.S. by March. What do you guys think about this?
Well, look, I cannot say this, and after just speaking with Dr. Ben Shavers, if there was only one good thing out of what happened with the inauguration today, is that people couldn't gather for it, because it could have been another super spreader with the pandemic still going on. We do understand it, and I don't think any of us cannot say we don't know anyone has either had it or know someone has passed away, and that's so unfortunate. Yeah. And we want to move forward, but you can't move forward without thinking about how Donald Trump did not handle this. So you have to feel better knowing what Biden's plans are moving forward, and that he's going to get us through this pandemic, and we can get through it together.
He just showed it. I mean, even you were talking about the inauguration. A big difference was everybody wearing masks. Yeah. They took their masks off at the podium, and then put them back on. Everybody was wearing masks, and we did not see that from any of the rallies or events or parties that Donald Trump held. We didn't see that.
I was really, really happy, because at first they just had the tight shot. If you guys noticed, it was just the tight shot of like the stage, but I was really happy when they showed the lawn. Did you guys catch that? The people so I remember going to Barack Obama's inauguration and how we were like packed tight on. I remember like freezing out there, and that this time, I mean, it was like I don't know, maybe like 20 rows of people, but they were spread out. Like it was just so, it was handled so
responsibly.
Oh my God, it was handled so responsibly.
Confidently.
I mean, you know what? And it's the fact, like we always talk about the bar being so low, but the fact that like I'm praising the fact that, wow, they had a socially distant inauguration with not a lot of people. But I mean, the last 4 years have been irresponsible, that it's kind of like, I was very happy to see that.
I think with the new strains, the new variants that, are being discussed in the news right now, there's a lot of confusion and a lot of fear. What we're going to do next week is we're going to have Dr. Bernard Ashby in as our guest, and he's going to really break down what these new strains are, what we have to fear, and if we have anything to fear, how strong the vaccines are. He's going to break it all down for us. So I want to make sure that everybody tunes in for that episode.
Okay. I'm definitely looking forward to that.
All right, new analysis shows Black Americans are getting COVID vaccinations at dramatically lower rates than white Americans in the first weeks of the chaotic rollout. According to KHN, about 3% of Americans have received at least one dose of a coronavirus vaccine so far. But in 16 states that have released data by race, white residents are being vaccinated at significantly higher rates than Black residents, in many cases 2 to 3 times higher. In the most dramatic case, 1.2% of white Pennsylvanians had been vaccinated as of January 14th, compared with 0.3% of Black Pennsylvanians. The vast majority of the initial round of vaccines has gone to healthcare workers and staffers on the front lines of the pandemic. Now, that's a workforce that's typically racially diverse, made up of physicians, hospital cafeteria workers, nurses, janitorial staffers. If the rollout were reaching people of all races equally, the shares of people vaccinated whose race is known should loosely align with the demographics of healthcare workers. But in every state, Black Americans were significantly underrepresented among people vaccinated so far. You all know that I'm very passionate about this, but this is what I've been saying I was afraid of, that the rhetoric is dangerous. And we're, of course, people have questions and we're not sure, but I am terrified of what I just talked about right there, and that it's going to just get worse. We are already dying at a disproportionate rate. And I am terrified that we're going to get, months down the line, nearly a year down the line, and we have something that can protect us from this. And we're seeing our communities still devastated by this. Our grandparents, our uncles, cousins, young people dying when white Americans are protecting themselves.
Well, I wanted to add just some news about California and the vaccine. Not Los Angeles specifically. This is actually to San Francisco. So the state health director officer, Erica DePan, she says that California, a state that has 40 million people, she says that per week, California is getting 400 to 500,000 doses of the vaccine. But remember the last week or earlier this week when we were saying, oh, people 65 and older are going to get first access. Like, oh, this is a great thing. But they're like, at this rate, even, it's still going to take, because we have so many people in California, even to get the people 65 years and older, it's going to take 20 to 22 weeks. So, I mean, you know, although we're excited about this, it's still going to be a long time until the majority of our people can get vaccinated. Also, the San Francisco mayor says that the city's health department is going to run out of their vaccine allotment this week, and that they're desperate for more doses. So even though, you know, the rhetoric is definitely important, there are some, like, you know, important facts about the fact that the vaccine, we don't have as many doses as we need and that we think that we actually have.
Right, but these numbers are based on who's already gotten it. So if you look at those numbers that you're giving as far as, and what did you say, how many % of people that can get it, that will be able to get it with the numbers that we have now with the vaccines coming in?
Said, what, 22
did you
weeks
say,
or something like that?
No, I said it's going to be 20 to 22 weeks until even the people, just the people 65 years and older can get vaccinated.
And then those are only the people who want to get it. So even it's taking that long, and then once we even get to that point, Black Americans are choosing not to get it.
Yeah.
So even getting to that point, it's going to be a bunch of 65 and older white Americans, white Californians.
So you're making it clear that it's more so available for them. It's not so much that we don't want to take it.
We're not making it available. No, I'm saying we are not making it available to ourselves. We are saying no.
How are we doing? Okay, by saying no. So you're saying that Black people are not making it available to ourselves because we're saying no to it.
When you have the option to get it, they're not choosing to get it.
But
at a disproportionate rate. And we're also on top of that. I'm just terrified of like more of our people dying.
Yeah.
Well, I totally agree. I mean, we're down at a higher rate.
Yeah.
And in a race, if you think about it, the numbers don't lie when it comes to that. And there's still the questions: do we want to take it? How we feel about taking it? But then again, there's so many lives that we're losing each and every day within these households. There's a lot of empty seats at the dinner table, and that's very unfortunate.
I just want a quick update on my granddad. He did get the Moderna vaccine. He got his first dose. He is feeling absolutely fine. He said he felt no side effects. I check in with him every day. He is perfectly fine. So just for anyone that, you know, might be 65 years and older or have access to the vaccine, my grandfather just got it. He says he feels fine.
Okay.
That's good to know. Yeah, I'm glad he's feeling good
to know, because I've been checking on him just to see, you know, anything. He's like, I feel totally fine.
Definitely good to know.
That's good to hear. Yeah.
All right, stocks open with gains of the first day on Joe Biden's presidency, while strong quarterly earnings for Netflix helped the NASDAQ composite reach a new high. The Dow Jones Industrial Average opened with a gain of roughly 100 points today, hours before Biden was sworn in as U.S. president. And S&P 500 opened with a gain of 0.6%, and the NASDAQ rose 1.4% thanks to a 14% increase in Netflix stock. Now, while the stock market is driven by innumerable forces, today's rally comes as Wall Street traders bet on a relatively quick passage of another coronavirus economic aid bill. So if you think about the stock market being excited because they know that this administration is going to make sure that more checks are going to go out to help the people that are in need. Well, that's going to go right back into the economy, which we need that, right? We're talking about Joe Biden. I believe it's a $1.9 trillion plan. He wants you to help jumpstart and get the vaccinations into order. So he has plans, and the stock market sees that, and they're excited about that. And on top of that, if you have a home, like right now, these interest rates are at an all-time low. So people are getting equity out of their homes. They're going out buying things, maybe catching up on bills, you know, kind of treating themselves, even during the pandemic. So those are some of the reasons why the stock market is being so successful right now.
Yeah, apparently Amazon and Netflix, their stocks went up dramatically. I believe Netflix went up by like
17%.
17%.
Yeah.
And Amazon jumped even more than that, like considerably more. So I'm sitting here kicking myself.
I was going to say, because
Jimmy's about to get into stocks, though, right? Like you were talking about it earlier.
Melissa says she promised me that this weekend she's going to help me. I just got my Robinhood account, okay? And she says she promised me. So when I come back Monday, if I don't have some info on stocks, Soulmates, you got my back, right? Melissa said that she has me.
Yes, I promise that I'm going to send you guys a link to the 20 best stocks to buy.
Get the stock game up.
Right now while
we're
since
tired, too.
Biden has become president. Absolutely.
Okay.
It's the long game that we're interested in.
The long game.
Yeah, the
Yes.
long game.
All right, now taking it to our YouTube soulmates, Marco Polo checked in and he says, this was a great day for America, and I absolutely agree with you. CM says, Biden and VP Kamala have a lot of work ahead. The plainest Jane, this is one of my favorite comments here. She says, I loves me some black, and she said, loves me some black news. She says, is it just me, or does anyone else get tired of seeing people that don't look like them delivering info about them day in and day out? Well, you know we got you every single day, 4 p.m. right here
man.
on Fox. So last one, Casey Bizboss says, how are you guys doing today? 2 shows, y'all jamming. That is true. You know, you eat a cup of coffee, you know. You're like,
Or
That's-
five.
that'll do it.
or 2.
Or 5.
I'm not going to lie. When we go to break, I'll take a sip, you know, and that's how we are doing. But we are going to keep giving you guys a great show. More comments are coming from our soulmates.